Thank you. I will now recognize Representative Ramirez for 5 minutes for questions.
Thank you. And I want to thank Chairman Bost and Ranking Member Takano for holding today's hearing. I also want to thank the witnesses who are with us today. For the last hour, you've heard from several of my colleagues on issues spanning from mental health to fiduciary issues. I should be able to pronounce it well. We've said it about 35 times in the last hour. But I want to take a moment to refocus on why we're here, why every single one of us here chose to be a member of the Veteran Affairs Committee, and why you sit here and the people that are sitting here listening. We are here for our veterans, our first-generation veterans, our veterans of color, and even some of us are here for our veterans who've been deported after risking their lives for the country we love. These veterans need our support, and the VA support in providing them with wraparound services and other resources they may need has to be our priority. We can go back and forth and blame game all day here. But let me just say what I think some of us have said here already. 121 suicides per day. 121 veterans commit suicide every single day. And if you do the math, that means in the hour that we've been debating and questioning and talking here and blaming each other, 5 veterans died. So I really want to make sure that we refocus ourselves and ask ourselves, what the heck are we doing as Congress, as the VA, and as every single organization who's committed in ensuring that our veterans have what they need so that they don't feel that life is such that they no longer can live. So I actually want to really focus on the mental health part here, because I think others will continue to talk about the other pieces. I want to ask you, Mr. Burke, what are the initiatives that the VA is spearheading to address the concerns with seeking mental health services for our veterans?
I think, honestly, ma'am, thank you for that question. This may be one that we come back with some further information from the VHA side of the organization. But I will tell you that every entity within VA is committed not just to suicide prevention, but making sure that we're communicating all rights, all avenues for access, for care, and for benefits. On the VHA side of the house, a very heavy focus, as you can imagine, on improving mental health. We have a suicide prevention office, obviously, and those folks are connected. It's a I hate to use a generic term, but a synergistic approach to us tackling mental health crisis and also making sure that we're putting a primary clinical focus on preventing veteran suicide. And we're happy to connect with you and members of the committee on more detailed information on what we're doing in that space, if that would be helpful.
And we know we're not doing certainly enough, right? I mean, enough is when we know that no veteran has to make that decision between life and death. So we have a lot of work to do. I do want to follow up and say, I mean, we know it's critical that we prioritize. We know it's critical that we do more. We know it's critical that we get into the nuance of what's happening in the supports and the claims. However, mental health and illness and disorders can also wax and wane over time. Mr. Burke, can you tell me what processes are in place for veterans to have the impact of their mental health issues reevaluated?
Certainly. With respect to the claims process, any veteran that's in receipt of compensation that has deteriorated or their condition has worsened, they have the opportunity to file a claim for an increase. They can come back and have another examination. We'll review additional evidence so that if they did have an increase or an exacerbation of their condition, that we could adjust the compensation rate and also ensure that's another touch point for us to make sure that they are in the VHA system, enrolled in health care, and seeking the appropriate attention there. But there is a claims process where we would collect new information, assess any potential increase in the severity of their condition, and then re-adjudicate a claim in that same fashion.
Thank you, Mr. Burke. Chairman, I yield back.
Thank you very much, Representative. I now recognize Representative Van Orden for 5 minutes questioning.
Thank you, Mr. Chairman.